Hi, it's Dr. Erica Dickie with Black Creek Mobile Veterinary Services. I wanted to take this time to update everyone on the status of Porter and his journey through palliative care and the most recent things that he's been experiencing with his recent surgery. All right, so here's what happened. Just prior to exploring some diagnostic testing, I noticed that Porter was not doing his absolute favorite thing, which was sleeping with me. I got up and I took a look to see where he was, and I found him right next to the heat register. And it broke my heart to see him like that because, well, number one, it brought up a lot of emotions from when I lost Smokey, because that was one of the things that he was doing during that time too. And number two, I realized that something was wrong and I had missed previous signs. You know, in a multi-cat household, it can be really challenging to sort through which cat may be ill if there is still pee and poo in the litter box and if the food is being eaten. We have automatic cat feeders that go off, and clearly Coco was eating Porter's food, and we weren't really aware of that until we started watching for further signs. The next day, paying closer attention to Porter, we realized that he was really lethargic and really wasn't interested in eating, and he always was one that he would hear the automatic food dish go off and would be running to go get the food, and that was not happening. So the next day we brought him into the vet clinic and we took blood work and we took urine and we took x-rays. And like a lot of the times in veterinary medicine, we run these tests and sometimes we're left with more questions. We ruled out a lot of things on the blood work, and that his liver and kidneys looked very healthy on blood work anyways. We checked his pancreatic enzymes as well as a specific pancreatic marker, which was normal as well. And his protein levels were normal, and just a lot of things that were normal. The one thing that was down was his red blood cell count was down, and he was showing an anemia in the face of dehydration. And that's not good, because when he's rehydrated, then that anemia will actually worsen. So that was the first thing. The urine looked fine. There was no evidence of infection or any other signs of concern, and he was concentrating that well. What was curious on the x-rays that we took a look at was that despite the fact that Porter wasn't eating, there was still food in the stomach. Now, there wasn't any specific gas patterns that looked like there may have been something that was obstructing his passage through his guts. But we decided to treat him. So we decided to treat him symptomatically that evening, did some subcutaneous fluids and medications by mouth, took him home. And it was a really horrible night. He was so weak and lethargic. He barely moved. He was turning his head away from me, seeking seclusion. Ugh, I knew something was wrong. So we repeated x-rays in the morning, and I had fasted him. Well, he didn't have any interest in eating anyway, so I didn't even have to specifically fast him. Fast means to not have any food. In case we were to go for surgery. And that's what I elected to do, because there was still a lot of food in the stomach. And why wasn't that food emptying out? You know, that's called delayed gastric emptying in veterinary medicine. And in general, food should move from the stomach within 4 hours after a meal. We weren't seeing that passage, so something was going on. Again, no signs really evident of a foreign body, but we went in anyways. When we went in, we ran the bowels and looked, and there was no evidence of any sort of obstruction or foreign object. So I guess that was a good thing. The other good thing was that grossly, from looking from the outside without evaluating the inside or the cells, his intestines all looked healthy, nice and pink and vital, which was great. What we did find was that there was no movement in his intestines. That's not normal. Clearly, you want to have that peristaltic wave that passes the ingesta down. Okay, so what did we do? We took biopsies. We sent those biopsies off, and I started him on supportive medications. One specifically very important supportive medication that was started besides fluid therapy was a prokinetic, and a prokinetic is something that helps move the intestines along. And so with time, it's been 1 week, we have found some significant improvements in Porter, including the return to his social self, his energy. His appetite has significantly improved, not quite back to normal, but improved. And he is passing stool now, which is fabulous. Today, we received the results of the biopsy, and those results showed that Porter has cancer. It is a really common cancer. It's called small cell lymphocytic lymphoma, and it can be challenging sometimes for pet owners, pet parents, pet guardians, however you consider your role in your pet's life, to understand those really vague signs of being unwell in pets as to what the cause could be, because IBD or oh my gosh, I forgot what it stood for a second. Inflammatory bowel disease and GI lymphoma or cancer both show very, very similar signs. And the only way to know that you're dealing with one versus the other is to go in and get a biopsy to have that definitive diagnosis. So it is absolutely okay to choose not to pursue diagnostics. You know what is best in your own life situation as to what you are able and willing to do. In those cases, you symptomatically manage your pet. For us, I'm thankful we do have a diagnosis. This provides me with an idea of a prognosis. It also gives me a sense of what to look for as time moves on, what to expect, what changes we may see, so that I can be prepared to help manage those conditions. And it gives me a very specific course of chemotherapy treatment that is now underway. I reached out to the Ontario Veterinary College Internal Medicine and spoke with a doctor there to get a consult, which was so incredibly valuable and helpful. This is something that as a veterinarian I'm able to do for my clients to help provide guidance and support for them, as well as refer for the actual consultation with the pet as well. So what are we looking at? Well, we're looking at lifelong therapy to manage this. Thankfully, in cats, chemotherapy is so much more better tolerated than it is in humans, so we are thankful for that. We'll be starting him on some treatments shortly, and we'll keep you posted of his progress along the way. There are studies out there that show mean survival time as much as 2 years, but again, it's really hard to say what if cancer was the cause of the death at that time. And there's a lot of concurrent diseases and illnesses that can come up after a cancer diagnosis that may end up being the eventual cause of a pet's end of life anyway. So I'm focusing on the here and the now, and the here and the now is that Porter is doing really, really well, and that I have the tools and I have the support available to help him along the way, promote the most comfort and peace of mind along this caregiving journey for him. The other thing that I think that I want to share is that before your pet, regardless of what their situation is in their health, before you reach a crisis, before you get to a poor or significantly declined quality of life, it is important to reach out within your community to find out about options in veterinary medicine, such as hospice and palliative care, or in-home euthanasia services, should that be something that is your wish, so that you can begin the end-of-life planning, so that when that time does come, you feel more prepared and more comfortable and supported in the decisions that you make along that journey. Thank you for listening.